Celebrating World AIDS Day by honoring community healthcare workers. These workers visit people's homes and assist them with their health issues. Health MEC Sasekani Manzini says community healthcare workers are an important part of curbing the spread of HIV and AIDS. She says the province is doing well in its efforts to achieve the UNAIDS 95-95-95 targets by 2030.
They go door to door. They also assist us in terms of the follow-up. Remember, Minister launched the 1.1 million gap in the country for those people who have tested positive, but now they went to take treatment, no longer taking it, or they did not take treatment at all. In the province, we're talking about 242,000. So of those numbers, we have already together with the community healthcare workers and our facilities now, because we do have the number per facility now, we managed to get 54% of that number, meaning that, and that was by the end of August. So we believe that, remember our goal is, the 2030 goal is 95, 95, 95. So we can say that as a province we are doing very well in the first 95 because we're at 96. The second 95, which is the one that we launched, the 1.1, closing the gap, where a person tested positive but they are not on treatment. So we are at 84%. And the last 95 also, in terms of the viral load suppressed, we can also say we are doing well because we're at 96.
These community healthcare workers say their work is yielding positive results.
I'd like to encourage South Africans to go to facilities and get tested, to those who don't know their status, and then those who know their status, they must adhere to treatment.
We assist people in their homes. We usually find people sick and most times they don't know what is wrong with them. But we encourage people to go to clinics and get tested. There are a lot of people who we have assisted so far through our jobs. We also find that most people start treatment and stop. So we remind them of the importance of the treatment even if it feels like they are not sick anymore. The Oram Institute in Mbombela uses interpersonal consultations to encourage people, especially men, to know their status.
So what we've seen over the years that when men are given that interpersonal care and support, they do test, they do also get to stay on treatment. We've tested over 2,000 men in the Manzini area, and we have about over 430 men that have been remaining on treatment. And when they stay on treatment and they are given that interpersonal care and psychosocial support, we're able to tailor-make the support that they have to bridge in the challenges that we've seen with men staying on treatment or actually suppressing, that is the last 95, is economic issues, social issues like alcohol and substance use, which is a barrier that we are trying to bridge. So we have a coaching model that is a peer-to-peer, whereby you're getting that support on a peer-to-peer level.
The latest statistics show that around 8 million people in South Africa live with HIV, which is estimated to represent a prevalence of about 12.7% of the population. Nhlanhla Jele, SABC News, Mbombela, Mpumalanga.